Welcome to Reflections on Identity, a podcast series explaining educators' narratives on their professional identity. Today, we are talking to Charlotte Wake, a dental hygienist, educator, and researcher. Charlotte, welcome to this series. Could you start off by just telling us a little bit about your role?
Thank you for having me. Yes, I have quite a few roles at the moment. I do work 2 days a week in practice as a dental hygienist. I'm also working as a PhD student, and I'm also doing a little bit of research work as well. I also work as a visiting lecturer for the University of Bedfordshire. So I have somewhat of a portfolio week or month at any given time.
Thank you.
And would you say professional identity is something that's important to you, Charlotte?
I think, to be honest, Neil, it's almost crucial because for me to meet all of the requirements for each role, I have to be very, very good with my boundaries. So for me, and I've listened to other people talk on your podcasts, and I know that others identify themselves as having one overall identity with these different aspects, but I don't see my week like that. I see myself as having separate professional identities given the day or the role that I'm doing. So it's very individual. So if I'm working on clinic, I see myself professionally as a hygienist, but I wouldn't then be answering emails for university or working on my PhD. So I think because I'm doing so many things, I try to keep them very separate. And the way that I introduce myself varies depending on the context of which I'm being asked who or what I am.
So I suppose you've got professional identities then, haven't you, with the emphasis on the plural there. I mean,
Yeah.
how do you navigate those? I mean, it sounds like you're quite disciplined in terms of how you perceive yourself in a given context in a given week. I mean, do you ever find any overlap between those or any clashes between those, or are they fairly neat and straightforward?
I'd like to think they were neat and straightforward, but in reality, things seldom are they? I think the way that I like to feel it is that I'm an educator all week, just in different realms. So, for example, on clinic, I'm helping my patients with their oral health, therefore, I'm educating them in the best ways to do this. Part of the week, if I'm lecturing, or I'm supervising research students, I will be assisting them in facilitating their education. And if I'm working on my own PhD, I feel like I'm educating myself and trying to strive with the help of others to be the researcher that I want to be. So I think they do bleed but over each other, but the way that I manage them time wise is by allocating set days and set times to them. And I've played with this a little bit because there's been times where I've done an hour of PhD work and then an hour of lecturing and then an hour of back on the PhD. That didn't work for me. It probably works for others, but it didn't for me. So I do sessions. So I'll do a morning of something or an afternoon or a day. And I am very regimented with that time. And I'm very regimented with breaks as well. So I think it's really about finding what works for you when you're juggling so many different things.
And I mean, you've obviously got one foot in medicine and one foot in education. I mean, do you perceive any sort of similarities and or differences between both how you perceive identity in those roles and how you've seen identity perceived within, the medical profession and in the education profession, or do they seem to be fairly similar in your view?
I think there are some differences. I think the main difference for me is about how others see me and my role. So I'm not sure patients always see us as facilitators in the same way that I would like my students to see me. I think patients sometimes look for answers, and I don't always have them. I wish I did, but I don't. And I think that it's more about what they want me to be as a professional. And I think those are the differences. I think it's about societal expectations are very similar in the fact that they expect professionals, no matter what standard or what regulatory body you have, you're expected to conduct yourself in a set way. But for me, it's more about the perception, and I think the uniform really helps with my boundaries. I think the uniform is a big part of that, because it is the signal to the world, isn't it? Almost about part of your identity.
Yeah. And where does collaboration come into that? Or, I mean, do you see your professional identity as something very individual, or does it have collective or kind of, yeah, collective attributes to it? I mean, is it something you see as a sort of social entity as much as an individual one?
So I suppose we really get into the core of how much of a community of practice there is in practice in dentistry, and I'm sure my colleagues will probably agree. It's pretty lonely. It's pretty isolated. You do ideally work with a nurse if you're fortunate enough to have a dental assistant, but that isn't a given in my role, and you can spend a lot of time on your own. And as a PhD student, I spend an awful lot of time on my own. So I think the collaborative nature that comes from education and being an educator is really rich for that collaboration. But the one thing I think for me that has been constant throughout forming my professional identity is mentorship. In each of the roles, mentorship has helped me understand who I am, and it's helped me collaborate, it's helped me feel safe, it's helped me feel confident, and it's helped to define me and give me a sense of belonging. So I think not necessarily collaboration through many people, but I think almost a mentorship aspect of a support. Not necessarily a network, maybe an individual, but that has made a big difference to me across the board on all of my different roles.
Carol, I'm conscious of your expertise, particularly in that area around mentorship. Is there anything you sort of want to take forward with Charlotte in relation to that, bearing in mind it's a sort of a specialised area of your work?
Well, firstly, to say thank you to Charlotte for really emphasizing the power of mentoring. I think that's really important. But yeah, interested to know, I suppose, the nuances of how that supports you. So you've talked about a community of practice, but then you've talked about almost that community of two, haven't you, with mentor and mentee?
Mhm. I think for me, it varies as well on the mentor, if you know what I mean, and the skills they bring and the relationship. I've been really fortunate, and I am totally aware of how fortunate I've been to have mentors. I am fully aware that there are people out there that do not have access to a mentor, and I try to mentor at every opportunity I can. But I think it needs the relationship for me is quite can be quite fragile in the fact that it needs nurturing, it needs feeding, it needs nourishing. And I think I'm always very mindful of all that is being offered from my mentor to me, and I never take it for granted, but I try to equally pass on to others when I can mentor. So I think for me, the nuance of role modeling is important, both for my professional identity from through mentorship, but also seeing the great skill mix that's offered and the time. People are so generous with their time, and it's something that I'm very passionate about. And so I apologize if mentoring isn't your thing, because because it certainly is mine. But I think the nuance of what you were saying, Carol, is more about the confidence, the safe environment. I think that's what's crucial. It's the safety in it. It's the ability to be able to explore without judgment.
Yeah. And it sounds like very much what you're talking about is a very much a synchronous relationship there where you're working together, as opposed to that, well, anyone that's looked at any of my work will know the master and apprentice thing is often offered as a model that doesn't work as well as what you're talking about here, I think.
I think
But that's
so.
just a plug for that idea, really.
Yeah, I think it's valid though, isn't it? Because it might depend on where your mentor came from. So my first mentor came from a, a hierarchy of being a teacher for me, an undergraduate level, and then over time that balanced itself and we became more peer and colleague. And it takes time, and it takes a will on both sides to do that. And I think the second mentor that I've been fortunate to have has many different aspects, from supervisor through to mentor. So I think it really is about boundaries again, isn't it? It's about saying, okay, we meet today in a mentorship capacity, or we meet today in a supervision capacity, and they don't bleed over. Because I think if they bleed over and the boundaries blur, it's almost that relationship you have between professional and patient. There's always a risk if it blurs, and that's why there is guidance to say it shouldn't. And so I think the hierarchy for me, in my experience, can be leveled out though, and that has happened in my working life.
Mm. Thank you. I don't want to dominate with mentoring questions, Neil.
Okay. I mean, another question I was going to ask Charlotte is, identity is sort of ethics and values are implicit or perhaps explicit within that, aren't they? And you've alluded to those already. I suppose it's a double-edged question, really. I mean, what values do you see yourself as kind of embodying? I mean, in what sense do your professional identity encompass certain key values? And I suppose the last part of the question is, have you ever had any experiences where those have come under challenge, or you've felt under pressure because of those values or ethics, because of things happening in the workplace?
Yeah, it's a great question. I think not so much in the workplace, but I think on a personal level, and I'm very happy to share, but in 2020, I was diagnosed with non-Hodgkin's lymphoma. And so what happened was I went from having an all-encompassing identity of a professional element, and all of that got sidelined, and I became looking at the personal self. And it was during the time when COVID hit, and I did actually remember going for a kind of walk down the seafront. I remember thinking to myself, and at what point am I Charlotte that's a hygienist, and at what point am I a hygienist called Charlotte? And I just thought, I'm not sure I've got the balance right. I'm not sure I've got my boundaries right. And it forced me to say, okay, I need to have treatment. I need to take time out. And the reevaluation that happened with that was a challenge, because when I went back to work, and even to this day, I don't have the energy I had before I was poorly. So what that means is I have to prioritize. So whereas before I would say yes to everything because it was all exciting, I then had to say, no, I can't do everything. I need to prioritize. But what it did do was make my PhD happen, because it made me say, if I'm going to do this, I need to do it. And it had always been in the back burner and always been a bit like, oh, and it's probably the only thing really now that I don't fully have an identity for just yet, because it feels like I'm still finding myself as a researcher and as a PhD student. So I think what it can do isn't, the challenge doesn't always come from the workplace. I think we always think it will, but I don't think it always does. Or in my case, it didn't. It was life that threw the curveball that made me stand up and say, actually, let's reflect on this sensibly. And creating a safe and honest environment to reflect is really important, I think, if that answers your question.
Yeah, yeah, certainly. I mean, in terms of the final question, Charlotte, if we go back to the values aspect, do you think that the professional values you have to epitomise are the same in both medicine and education, or do you notice any differences between them?
No, I think they're really similar. I think, um, I think going in with honesty and integrity is important. I think going in and understanding the drive for why you're there, and in both points, it's the same. I've always wanted to make a difference. I want to make a difference to my patients and their oral health and their comfort and their quality of life. And I want to make a difference through medical education and dentistry. The ripple effect is so much bigger, isn't it? So I can help one person in practice, but by helping an educator, I'll never know how many patients I ended up helping. So it's very multifactorial. And I think the values that you take from that, from role modeling of others, and from just the sense of self, I think they're really key. I think if you're a professional across the board, there are standards and society expects something from you. And at what cost? Well, in dentistry, the cost of having the privilege to care for somebody. That's what the cost is. So yes, you don't promote maybe things on social media that you would if you didn't have a regulatory body, but it's a very small price to pay when they're giving you the privilege of divulging their medical history with you, and you have the privilege of treating them. So I think it's an easy swap.
That's a lovely way to sort of round off my part of the sort of like the session anyway. So thank you so much, Charlotte, for giving that overview and an interpretation in two sort of similar, but in some ways very, very different areas of professional practice. Carol, do you have anything else you want to add to the
Uh,
episode?
I don't know that it's much of a question because I think you've discussed this, Charlotte, about, we normally ask how much influence you would have as an individual over your professional identity, but I think the examples that you've given have shown that that's very much the case for you. And part of me just wonders if that's, I know you shared a personal example and obviously the influence that has, but I also wonder if the fact that you have so many different roles is one of the reasons you've had to almost adopt and take control of your identity.
Yeah, I think that's a really good point because I think when you've been so poorly, I think it makes you reevaluate everything, and you almost want to do everything that you can. So then suddenly you get really busy because you want to try lots of things and do lots of things, and I think yeah, you have to sometimes put a lid on some of it and be selective. So I think things that lead to other things and the ability and having the opportunity, you don't want to miss opportunities, but I think you still have to be sensible on what you take on. So yeah, I think in answer to that question, for sure, I think it has a different challenge when it comes from other places. Yeah.
Thank you, Charlotte, for being so open with us and that honest interview and sharing some really fascinating insights.
Well, thank you for having me. I've really enjoyed it. Thank you.
You have been listening to Reflections on Identity. We hope you can join us for the next episode in our series. We'd love to hear from you, so please put your thoughts in the comments. And if you want to be notified of the next episode, click the bell icon or follow. Bye for now.